Good morning. I'm Dana Hanson. I have a daily word for you. I have a couple questions to start with. Did you know that the world child mortality rate has dropped over 50% since 1990? Yeah. According to a UN report, children under the age of 4, 13 million of them died in 1990, 5 million since the latest compilation. Over 50% of the kids saved. Hmm. Did you know that over 60% of people throughout the world who were in the extreme poverty category are no longer there? Yeah, the extreme poverty rate has dropped from 1990 until the latest measurements. So those two things alone, over half the infant mortality or infant and child mortality rate has dropped in 30 years. And over 60% of people who are in extreme poverty throughout the world has dropped in 30 years. Actually, this is the most astounding good news ever in the history of the world, other than the life, death, and resurrection of Jesus. So, why did this happen? Was it a bunch of government programs? Was it wealthy countries sending lots and lots of money to where there are poor people? Oh, I'm sure that helped a little, but leading economics teachers in these areas of expertise, in terms of the economics of microeconomics and global poverty economics, no. They said primarily it wasn't any of those things. It's a freedom for people to start micro businesses and small businesses and being able to do that freely without government interference and a huge increase in availability of electricity throughout the poorest of the poor areas of the world. Unprecedented, other than Jesus, the best news this world has ever heard. Now, notice how I keep using a verb was. You see, now global economic decisions have been made primarily by politicians and public health officials. And they've decided to overwhelmingly stop economic activity for the vast majority of people in the world, especially the poorest of the poor. They are the hardest hit. Those who have been rising out of extreme poverty. Now, I'm not a mind reader, and I think that our politicians and public officials may have indeed good intentions to save lives. But at the same time, many of the leading minds in economics and global poverty sounded alarms and continue to sound alarms. And I wonder if they're being heard. The problem is they're not politicians primarily, and they're not public health officials. Now, you could see this coming if you had any knowledge of these fields and how quickly things can change in terms of disaster, especially for the poorest and most vulnerable. Well, that's exactly what is happening. How do things look now? Well, I'm not going to comment on coronavirus. You can do the math. And you can ask questions like these. You can ask, who's dying? And how many years of projected life expectancy has increased for these individuals now as a result of taking such drastic global economic measures? Or you can ask yourself another question. What was the projected life expectancy for those who have died if they hadn't been infected by coronavirus? Did they have any other morbid health conditions that may have been a factor in their death? What would their life expectancy have been then, even without coronavirus? See, many say no one saw this coming. This is a once in 100 years endemic. I think that's absolutely true, except for part of that statement. Many other people saw it coming and have been giving warnings of the overwhelming evidence of a much worse global public health crisis, a disaster that's coming our way. Actually, it's already here. I'm not going to comment about all this. You can read just as well as I can. I'm going to simply highlight two sources. First source, the UN and World Bank. Let me read this. I quote. This is released on Thursday. The new coronavirus, which causes the respiratory illness COVID-19, first emerged in the Chinese city of Wuhan late last year. So far, it has infected more than 2 million people, killing some 138,000 in 213 countries and territories, according to a Reuters tally. Compared with adults, children infected with the coronavirus are less likely to have symptoms and more likely to have a mild illness, US and Chinese studies have found. But the UN report warned that economic hardship experienced by families as a result of the global economic downturn could result in hundreds of thousands of additional child deaths in 2020. The United Nations also said an estimated 42 million to 62 million more children could fall into extreme poverty as a result of the coronavirus this year. My second source, the Gospel of Matthew, chapter 2. This fulfilled the words of the prophet Jeremiah. I hear the screams of anguish, weeping and wailing in Ramah. Rachel is weeping uncontrollably for her children, and she refuses to be comforted because they are dead and gone. Lord, have mercy.